always also look forward to talking to my next guest, Professor Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford. Good morning to you.
Good morning, Julia.
Thank you so much for joining us. Lots to talk to you about. First up, I just want to ask you about this lockdown report published today. The Institute of Economic Affairs has published it. It's a massive, big meta-analysis carried out by Johns Hopkins University and Lund University. It involves a number of co-authors. They've looked at all of the different data available on lockdown policies and other non-pharmaceutical interventions, NPIs, that we've talked so much about, whether it's masks or closing schools or track and trace and the like. And they've discovered, this will not come as a surprise to many of us, that the first lockdown in spring 2020 in England and Wales saved just as few as 1,700 deaths in England and Wales. Given that 11,000 people die in an average week in this country, sadly, not that many, but there were huge, staggeringly high costs, which we're living with right now. Do you think that anyone involved in government and involved in the scientific advice given to government will ever accept that what they did was the wrong thing?
No, I don't think they will. And I think this is going to be a huge problem of the inquiries. People are going to go into defensive mode and just make sure that they don't become the scapegoat. But if you look at what's happened here, we've had the modelling that I think your previous guest just mentioned there from Imperial. We were going to have 500,000 deaths and somehow it was going to get down to 20,000, really pushed the government into lockdown and restrictions. Then we ended up in them for far too long with many ridiculous interventions, rules of 6, 10 o'clock curfews as though
Scotch egg, never forget the Scotch eggs.
Yeah, the Scotch eggs. But what this shows is, the important issue about this study is, what it shows is individuals and societies are very good at judging risk. And believe it or not, we are happy sometimes to go, oh, the risk is too high for the next few weeks. We'll stay inside and reduce our movements. And we did that before lockdowns. And that's where most of the benefits came. But what it also shows is lockdowns do nothing for care home transmission and nothing for hospital-acquired transmission. And they deliver massive harms that are going to be ongoing for the rest of this decade.
Yeah. And again, the people say, well, we didn't know that well. I mean, people like you and many others, Carol Sikora, were speaking out. I mean, but, you know, the cancer research was speaking out within a month, saying people aren't coming forward to get cancer treatment. We need to do something about this. People were very aware of the harms very early on. The government was aware of them. But, of course, they were aware of them beforehand, which was why lockdowns were never discussed by SAGE, the advisory committee, because they had been ruled out many, many decades ago by health professionals because the costs of locking down a society was so great on the basis that you couldn't stop a virus anyway. And we were told again it was only about, you know, flattening the curve so we didn't have lots of people getting ill and being in hospital at the same time. And then it became about saving lives when actually the evidence had all been you weren't actually really ever going to save any lives by lockdowns, because at some point you come out of a lockdown and then the virus spreads again.
And the other thing that happens is, if you're looking at the data, is when you come out, all of the other medical conditions actually worsen. Yeah. All of your cardiovascular disease, all of your diabetes is worse, your blood pressure management. Then you have the mental health burden. And then important is what you've done to children in that period of time. And I do think right now, this is one issue with the COVID inquiry, is it needs to say, look, prioritise some things. What do we need to do to children to help them catch up and get beyond all of the lunacy that we've seen over the last few years so that they can restore their mental well-being? But also many of the educational losses that have occurred now need to be fought through, and we need to have something that impacts our younger generation so they can get beyond what has just happened.
Oh, what was allowed to be done? I'm not saying what we did, because we didn't do it. We fought against it. I never, wasn't a single day when I didn't fight against schools closing, was criminal. I think it actually was criminal. Look, you've given evidence to the COVID inquiry. You, of course, at one point did get into, I think it was it December 2020 or autumn 2020, to speak with the then Prime Minister Boris Johnson. The latest claims we've seen over the weekend is that, you know, scientist John Edmonds claims that the Eat Out to Help Out scheme back in the summer of 2020 saw cases rise and was, you know, classic example of something that Rishi Sunak, now Prime Minister, had been responsible for, and that he wants to sort of, you know, he wants, you know, us not to know the details of. There's no evidence, is there, that Eat Out to Help Out contributed to cases rising?
Well, look, I think this is important. What you're seeing is these modelers trying to deflect blame from themselves to say we never got a single prediction right.
Yeah.
And in doing so, we sent us into further lockdowns and couldn't understand basic principles. So what happens over August is that actually with the natural social distancing that occurs with the closure of schools, all respiratory infections drop. As soon as schools come back in September, they start to rise again.
And we saw this across every European country pretty much. Their case, they followed exactly the same model, and they didn't have Eat Out to help out. And anyway, it was actually, it was an economic policy as well. It was about people who've been terrified out of their lives, and it was about getting people out who wouldn't I remember my in-laws going out for the first time, sitting outside, social distance, all of that, you know, and going out. And it wasn't just about boosting the economy. It was about saying, look, it's okay out there. Live without fear, which is what we should have been continuing to do.
And one of the arguments about creating a virus to become endemic is at some point, the people at low risk, all of those who are working age would have to get the virus. And if they got that earlier, as opposed to transitioning into winter, then the problems would be less. And that's exactly what Sweden did. What we want to do and what these modelers want to do is still have you believe that lockdowns and restrictions were the way forward. There's a delusion going on here that in some way they have to get beyond and then start to help us understand why did they get the prediction so wrong? That's what we need an answer to.
Absolutely. Well, we know why. I mean, you know, the prediction from Neil Ferguson at Imperial. I mean, every prediction he's ever made has been out by a factor of goodness knows what, and yet he's still talked to. And by the way, is still an advisor to the government. SAGE still hasn't been disbanded, which I still find absolutely terrifying. It seems to me that pretty much everyone who's involved in some of the worst decision-making, the worst advice to the government, not the government always followed science, but they were given very bad advice, very one-sided advice that didn't look at repercussions and cost-benefit analysis. They've pretty much all either been given a knighthood, an award of some sort, or they've been promoted, or all of the above. And that says to me that, you know, everyone's basically been given a gong and a bauble and been told, keep stum.
Julia, I don't think you and I are on the list for the gong, unfortunately.
Don't think we ever made. I'm holding out for Empress, as you know. Can I ask you just one final question? Front page of the Mirror today, exclusive, new fear for UK. Act now to stop TB horror. A British professor, Professor Robert Wilkinson, has said that a tuberculosis pandemic could hit the UK unless a one-shot cure is found. It would overtake COVID as the world's most deadly infectious disease. Ever since COVID, we've had non-stop a new mutation, a new variant, another disease, another pandemic coming. World Health Organization desperate to get more control over national pandemic planning. One of the reasons I know it's important to get the COVID inquiry to get the right answers is we need it quickly and we need the right answers, the right questions, is because we're going to have another pandemic. People are fear-mongering away right now.
Yeah, and I'm worried that actually what happens with this fear messaging is you're completely turning people off healthcare issues. TB is an important issue. It's an important global healthcare issue. But what we don't need to do is scare everybody about the issues. What we need to understand is with immigration and certain people from around the world, you can bring in more TB. It can also be related to certain features like housing and living. So what we need to do is put those diseases that are important up there. But you're right, if we keep providing this crisis, what's going to happen is we'll all switch off from public health, and then our healthcare, our mental health will worsen. And we need to find a new way of communicating as opposed to ramping it up the headlines with there's another crisis here. I don't think, though, this is going to stop anytime soon, Julia, because we're part of the problem because we click on the headlines as soon as it says there's a crisis.
Absolutely. And the fear-mongering sells. That's the reality. Carl Heneghan, you've always been just a voice of sanity and reason. I can feel a collective whenever you're on the show from the entire audience. Thank you very much indeed for joining us.